Gum disease has been around for a long time. It used to be known as pyorrhea. In fact, if you've been sitting in church and you've heard the term long in the tooth, that's actually relating to gum disease, not the age of an individual. Periodontal disease is actually caused by bacteria that's inside of our mouth. You hear it on TV, known as dental plaque. Now, some people will get that dental plaque, and if they leave it around underneath their gums without brushing it and flossing it, their gums will get puffy. That's known as gingivitis. About half our population, it will not go any further than that. It just stays at inflamed gum tissue. Now, for some people, gingivitis will progress into something known as periodontitis or periodontal disease. With that, it's the way that the body's immune system's interacting with the plaque that's inside of their mouth that causes the bone tissue to recede as well as the gums to recede away from the teeth, eventually resulting in loss of the tooth structure. Because periodontal disease or gum disease is an inflammatory process, some of those molecules escape into your bloodstream, and it can affect other parts of your body. We've associated gum disease with atherosclerosis, which is hardening of the arteries, which leads to heart disease. We also know that it's been associated with preterm birth weight in babies that are born with mothers with gum disease. We've actually seen that in people in nursing homes and such that have gum disease, they have a higher incidence of lung infections. People with diabetes and gum disease is a very bad combination. We need to keep the gum disease under control so that they do not require as much insulin. So gum disease does affect the rest of your body. It's important to keep it under control.